here today to introduce Jerry Bergman, who's a member of the New York City chapter, as well as chair of the HLAA New York State Advocacy Committee. Jerry.
Thank you. Thank you, Steve. Steve is a member of our advocacy committee. I've chosen to call this talk "To Be or Not to Be." That's because the subject is the creation of a commission for the deaf, deafblind, and hard of hearing in New York State. As some of you may know, 38 states have such a commission. New York State, regrettably, is not among them. And the record of New York State with regard to recognizing and providing services and awareness for people with hearing loss is really atrocious, but you'll see specifics in just a second. Right now, we have a bill that the New York State Legislature in its last session passed, and unanimously by both houses in Albany. And the bill is somewhere between the legislature and the governor, as I will explain in a minute. That's the news release that was put out by one of the lead sponsors, bragging about the fact that we were going to have this commission. Well, we're not going to have the commission unless the governor signs the bill. Why we need a commission? As you can see, we have knowledge and experience that most legislators don't understand what hearing loss is. You ask them for accommodation, maybe this happened to you, and they'll assign an ASL interpreter, and only 5% of us are ASL literate. That's just one example. We need better coordination in delivery of services, particularly for the elderly, different than what are needed by children, and different than what are needed by people in the workplace. And those all demand very different and specific types of accommodation and planning and policy. And Albany should have that available through a central source, as well as if you are setting up a meeting with an assemblyman or representative, and you ask for either CART or automatic captioning, that they don't ask you, well, what is that and how do we go about that? That's something that everybody in Albany should have an office where they can call and say, I'm having this event, I need assistive technology provided. The legislation, I worked with the lead sponsor in its development, and it's really excellent because it would provide an executive director who would report directly to the governor, 9 voting commissioners, 8 of them would be equally deaf and deafblind and hard of hearing, and a licensed audiologist. There would be 2 non-voting members. One would be a CART provider, and the other would be an ASL interpreter. There would be requirement for a statewide plan, process to collect and maintain data. Right now, we really don't have any good statistical data on the extent of hearing loss and how many people with hearing loss are on the mild to moderate end versus the severe to profound end. And even within our hearing loss cohort, there's a lot of difference in what we need and how we can best get effective communication. Questions so far?
So are you just saying that even though there's the ADA, and I think I asked my employer to help me, and I think they did. Is it just the education of the legislature that we're talking about? I mean, doesn't our hearing loss fall under the ADA?
That's really a whole other subject, because the ADA simply grants us rights, but there's no enforcement within the ADA. You have to raise issues and ask people to provide what you need as you're authorized to do under the ADA. And unfortunately, I do a lot of advocacy. Sometimes you'll get somewhere and sometimes you won't, at which point you have to try to go to one of the agencies that exist to help people who aren't getting served as they're entitled to under the ADA. But that's separate and apart from what we're talking about here, because the issue here is to provide through our state, to provide funding for education, to provide funding so doctors and health clinics know what our needs are through the health agency of the state, to provide educational services. Thank you, Charlie. So I mentioned, hope that answers your question. I've mentioned what the legislation provides, and that's where the legislation has to be put into effect. Governor Hochul's office. The process is that bills that are passed go to the governor, and the governor has until the end of each year to sign those bills into law. But I'm also told that if a bill or a piece of legislation is formally sent to the governor's desk for signature, she has 10 days in which to sign it. So we don't believe that's happened yet, but we don't really know, which is why I say, where are we? The governor's office is very cordial, very receptive to working with us, but is non-committal as to whether the governor will sign this bill. And that's not a knock on the governor or her office, because I'm learning as I go, and I learned that each legislative session, senators and assembly members put through hundreds and hundreds of bills, and many of them are voted through so that those politicians can go back and say, we did our job. It doesn't mean those bills will go anywhere once they're passed. It's up to the governor's office. So what's the position of the governor's office? They have to carefully look at everything contained in every one of those pieces of legislation. And they're very, very busy doing that at the moment. Our legislation, the creation of the commission, has fiscal implications. It requires an authorization of funds. So one of the things that's being done is that the attorneys and others are looking into what it'll cost to set up the commission we call for and maintain and run it with a staff of paid professionals. That's just one aspect of it. The other is, how will it interact with existing state government agencies and offices and lines of communications throughout. So that process is somewhere underway at the moment. I have heard from one source that some of the specific provisions that are in our legislation may be problematic from an governor's administrative position. So, well, that's not necessarily a bad thing, because, and we know about appropriation, but that's not necessarily a bad thing, because if our bill doesn't get signed into law before December 31st, but the governor's administration has carefully reviewed it and come up with a few modifications, they can revise the bill and it can be reintroduced at the start of the next legislative session in 2023. And my research has gone back as far as 2007. And if that's 15 years or so, if we have to wait another 12 months or so, to get the commission that we've been pushing for, so be it, because we will have a bill passed in the next session that the governor will be pleased with and her administration will be ready to implement, and they will be able to provide the funding to go along with it, the appropriation request. What we've been told is that they may want, the governor's office may want to resurrect something called the Interagency Council for people who are deaf, deafblind, and hard of hearing. The Interagency Council was created back around 2007, 2008. In 2012, it was subsumed when the Justice Center for People with Disabilities came into being, and it was placed under the Justice Center. As I say, it was originally under a commission on quality care and advocacy for people with disabilities. That was shut down when the Justice Center came into being. And in 2014, the state made some attempt to revive it. But where is it now? Again, New York State is still one of only 12 states without such a commission, and the Interagency Council is the wrong approach. Why? There we go. The bottom line here is we need advocacy, and every one of you can be an advocate. At the very least, we'd like you all to write to Governor Hochul. You can do it online and push a button and it goes through, but she needs to know that we're looking to her to do the right thing for us. Each chapter president should write on chapter letterhead to the governor so that we're all united in this, and she knows people throughout the state are watching. We should seek editorial coverage from newspapers, radio and television. And we just set up a change.org petition to the governor, and we're going to start distributing that by email to all of you. And you can share that through your chapter email list and through social networking. So we build a large contingent of people who are watching and supportive. So bottom line, we need to make our voices heard in a positive way, but that's kind of where we are. So if you have questions about how all of us can do our part to help, that would be great. We're leading the effort through our advocacy committee, but it really takes more than just 8 or 10 people to get this job done. And we're going to be hopeful that the governor will sign it, but if not, that the governor's office will work with us, and we'll see that the Interagency Council, which has been dormant since 2014 or 15, is not the way to go. One of the problems with the Interagency Council is that that legislation calls for the head of the Justice Center to be the executive director. And that person is not of, by, or for us. And that person has a staff of over 400 people, none of whom are people with lived experience as deaf, deafblind, or hard of hearing. So the other problem with it is that the commissioners who serve on would serve on the Interagency Council are all ex officio, which is another way of saying anybody can represent your agency, and they're ex officio representatives of all of the branches of state government who would come together, and that's an advisory group. We don't need an advisory group. We need an agency in Albany that will work for us. Thank you.
Jerry, what are other states doing? What kinds of commissions have been formed, and what have they done in terms of representing the people of that state?
I'm glad you asked. Last year, there's a National Association of Deaf, Deafblind, and Hard of Hearing Commissions. And they have input from all 38 agencies around the country, the states that have them. They did a study last year and they went into great detail. It's about 60 or 80 pages. I've given that to the governor's office because it's really a guide to best practice. And what they do is they have a director for the hard of hearing. They have a director for the deaf blind. They have a director for the deaf. That they certify, or at least, they certify ASL interpreters and help make them available. They certify and help make available licensed or properly trained car providers. They do research on the extent of the problems that our cohort faces in the state. Then, as I say, even beginning with statistics on the extent of the problems. They work with their state education offices on services. They do a great many things, and that report not only provides guidance for staffing, but also for budget and programmatic. And I've looked at some of the state's agencies, and every year they submit a formal report to the legislature on things that can be done to improve services and so forth. So there really is a lot. By the way, I should mention that this effort has united us with the Empire State Association for the Deaf. I'm the representative on the coalition with the deaf and deafblind, and we've worked to get the bill passed in unison. So we are 100% in step with the deaf community and advocates for the deafblind.
I would think that one of those states, or a combination of those states, might serve as a model for us, that we can say, this is what's successful in other states, and let's do it here. I want to make this personal, though, in terms of what this really means to us. Besides having the availability of knowing that there's a properly trained CART reporter or someone who is properly trained in sign language, what else will this commission do for us?
Well, I don't have the report in front of me right now, but I did go through what other states are doing quite a bit in research in working with the lead sponsor of the legislation. And our bill, that bill that was passed, mirrors the best practices throughout the country. So, you know, it really is a model piece of legislation. The only thing we do not know is how it squares with New York State and New York State government. And that's the process they're going through now. And hopefully we will come out with an agency at the other end, if not in the weeks and months to come in the next year's session. But now is a critical time, as I say, and we need to get support generated to the governor in a nice way, but say we understand, you know, you haven't yet decided on this. We hope you'll please sign the bill. I have a handout that didn't get run off in time for me to give out here, but it's a flyer and there's an accompanying draft letter, and we will be circulating that to all HLAA members statewide in a few days.
Jerry,
Mary asked what we would get out of having a commission, what's tangible. And my understanding, the way I would imagine the answer is that we'll have a voice in Albany where we don't have one now. We are invisible. So I think we're creating an advocacy capability that doesn't exist now. So I think it's the voice. We can now raise Cain officially within the government and start to advance our interests. No?
Yeah. Thank you, Pete. That's Pete Fackler, by the way, who's on the national board of HLAA. And I'm thinking of Pete's own experience. Pete was one of 2 members of HLA who were kind enough to testify at an assembly hearing on disability, coping with disability in the workplace. And we asked for accommodation, and they set up monitors for CART, and they provided them. But if you can imagine, instead of them being here up in front, they were out here. So when Pete and the other person representing us came up to the table from which they were testifying, they were looking at the politicians in front of them, but they couldn't see the cart because the cart was now behind them. You know, it's something that simple that just won't happen when there's an informed agency in Albany that represents us. And, you know, I also say all the time that we are not one group. The deaf have unique needs, the deafblind have unique needs, and the hard of hearing, and even when the heart, what does it say? Within the hard of hearing, we have different needs. I'll say, Mary.
Jerry, I was wondering if it's useful not only to write to Governor Hochul, but also to contact the legislators who sponsored the bill, and were there individual legislators we should talk to?
Well, I'm a little bit skeptical because, as I mentioned, hundreds of bills get passed, and the legislators can say, you know, I did my thing. But we only had a small number of co-sponsors for the legislation. The majority of the assemblymen and senators who represent you probably don't even know this bill exists, although they voted to approve it. So yes, absolutely. All of us should go home and call the office of your elected assemblyman and senator and say, hey, do you know about this bill? Would you please put in a good word, because it's up to the governor now to enact it, and it's really nonpartisan. There was a question over here. I'll get to you next.
Thank you. Suzanne Johnson from the Rochester chapter. Yeah, when Mary was mentioning, I wanted to respond to her comment about what good this bill would do for us. One of the things that I hope will occur as a result of this bill is the trickle down, where it can really affect our local governments. I was part of a council on people with disabilities in the Rochester area, which was represented by a variety of individuals with varying disabilities, motor disabilities, physical disabilities, visual, deaf, hard of hearing. And that was part of our local government because it was an important part of our state government as well. It was a conversation. That local organization has since been disbanded because that conversation is no longer happening. So I'm hopeful that this bill will help sort of recreate that conversation and excitement and interest in really providing accommodations for people with disabilities in general, not just the deaf and deaf, blind and deaf and hard of hearing, but other people with disabilities as well.
Thank you. I should mention that I'm not in favor of, at the state level anyway, of advisory committees, because they tend to meet and have discussions and publish minutes, and that's the end of it. I currently serve on the advisory council to the New York State Division of Human Rights. And that was set up this past year when Governor Hochul, early in her term, created the Office for People with Disabilities and a Chief Disability Officer. And she's had 20 plus years of Albany experience. She's been our contact to the governor's office, but I serve on that. I also serve on the Hearing Aid Dispensing Advisory Board. And believe me, we have trouble getting out of our own way. And you have hearing aid dispensers, and you have audiologists, and you have me as a consumer representative. And sometimes we're in agreement and sometimes we're not. And anytime we ask for some action by the state, the attorney that serves that group says, well, it's not in the legislation that empowers us. Our job is primarily to license the dispensing of hearing aids by audiologists, or audiologists dispense hearing aids. Yes, you had a question?
Yeah. Did you go over the number on the bill? Number, the state
Yes.
number of the bill? Did you
Yes,
go over that?
both the Assembly and the Senate bills both have specific numbers. I can give them to you now, but it's going to be in the e-blast that we send out. It's in the letter embedded as specifics. Yes.
Okay. Okay. Another thing, got one more. We do have a commission for the blind in the state. I was just thinking, why can't we co-locate with the Commission for the Blind? They've got all the assets. Just another thing. That's all.
Well, that's a good question. And it's a question that comes up every so often. And right now, I don't begrudge, any agency their commission. I think there are times when government rightly should work, as in the case of employment discrimination and services for people with disabilities in the workplace, where there should be a central office that administers that kind of on that kind of an issue. But the deaf, blind, and we all have different needs. So this would be specifically for our three categories, like they have in 38 other states, and that's what I fall back on. And anybody, the handout, the flyer I have will have my email address, and if anybody wants, I can give them my email address after the meeting. I can send you the report of the state association that did really a deep dive into what all these commissions do. Gloria?
I have a question from Debbie. She's asking, what about open caption movies to be mandated in the state of New York, not just New York City?
You remind me of something else. I'll answer your question in a second. Our advocacy committee is meeting in 5 or 10 minutes to discuss what our agenda should be for the coming year. And that's one of the issues on my agenda anyway. Open captions we got an ordinance passed in New York City that movies must provide open captions on their schedule, both during the week and on weekends, a limited number, but it's a requirement now for the cinemas to do that in New York City. We can push for a state bill, but that's precisely the kind of policy matter that this agency could put before the legislature from year to year for consideration.
Art Mauer from Rochester. I don't know how to ask this question in a way that I won't get thrown out of here, but anyhow, I haven't seen any language on any of this stuff, and I'm wondering if it's written in such a way that someone who is not plugged in to the needs of the people with hearing loss and the deaf would have an understanding of what the impact of this would be. In other words, so often legislation gets written in such a way that you really don't understand exactly what they're trying to do, okay? So what I'm wondering is we try to advocate for this, could we be targeted as
Thank
to
you,
what
Art.
we would really like to have the
You-
outcome of this
You make
be?
an excellent point. And someone asked me, mentioned recently that the state passed a bill 2 or 3 years ago to require open captions on monitors in places of public accommodation. Yes. In other words, if you go to a dental clinic and they have different rooms, each one has a TV monitor. This bill requires that they have captions. However, we were not consulted, at least I wasn't, I don't know who might have been, on how that legislation should be framed. Because what it says is, if you go to a sports bar and you want to enjoy watching the football game and there are no captions, what are you supposed to do? Well, the bill says you ask for accommodation. They're only required to provide it if you ask. Can you imagine asking a waitress in a restaurant? Right? Would you please put it, what captions? Where? I don't run that. I don't know how that's done. That's not me. Not to mention the fact that the burden shouldn't be on us. The law should have been written so that it says all these places of public accommodation have to have captions on the monitors, with or without sound. So that's another issue. We want to try to get that legislation amended. Another thing is, what could the commission do for us? When the pandemic hit, we were suddenly faced with the barrier of face masks to hear. I don't know about how many of you, but I can't understand anybody when they're wearing a face mask, you know? So why didn't the state issue a requirement that healthcare providers, hospitals, clinics give people the right to clear masks? You know, that's another thing the state could have done, but they don't have any source for that kind of input, advice to policy and decision making, as they have, as I say, in 38 other states. So we have a couple of minutes, 1 or 2, if anybody else has a question? No. Okay, I'm being told we should move on. Our advocacy committee meets in the Warren Room down that way. In a couple of minutes, we're going to be picking up on this and also talking about what we do moving forward. Thank you all for being here.